A heart surgery used to involve a big incision down the middle of the chest. Now it can be performed through a small hole.
It's a technique that's getting some patients back on their feet sooner. Wendy Rigby has the story, new at 5.
When Donald Kerr decided to quit smoking, he was given an EKG, only to find out he had a leaky heart valve that was threatening his life. The 49-year-old house painter feared the surgery.
If it crack me open, I'm going to be in this pain for all this time. Can't go to work for months and months.
Thoracic surgeon Dr. Seenu Reddy used a new approach on Kerr. In an operating room at University Hospital, he and a team of other specialists used catheters inserted through the neck and groin to deliver medicine that drains and stops the heart. Then, through a small incision in the right chest, Dr. Reddy used special lengthened tools, some more than a foot long, to reach deep into Kerr's chest and repair his mitral valve. The doctor has a direct view of where he's working.
The incision is smaller, it doesn't involve the dividing of any bone, and the overall trauma to the patient from the surgery is much less. That's the scar.
Kerr only has a 2.5-inch scar on his chest. He was surprised at how little pain he experienced.
Now, I've only had 2 pain pills since I've been out. I refuse to take them. I'm not in that much pain at all.
After 3 days recovering in the hospital, Kerr was ready to go home, and he should be back on the ladder with brush in hand much sooner than if he had had conventional valve repair surgery. Dr. Reddy says he'll do as well as patients who had the other approach.
Sure, a few months later, everyone's doing great, and they feel good, and they're back to their activity. But it's really remarkable to see when I've performed operations through smaller incisions, how much more quickly they get back to work.
Not everyone is a candidate for minimally invasive mitral valve replacement surgery or repair surgery. But for patients with the right build without other medical complications, this new technique can save weeks of recovery. Reporting live, Wendy Rigby, KENS 5 Eyewitness News.